Hello and welcome to the last session of the day. This is entitled Extended Peer Communities, Makers' Response to Covid-19 Pandemics. So for those that don't know me, my name is Paulo Rosa. I work at the Joint Research Center in Italy, where I work on the topic of citizen engagement in science and policy. I'm also the co-founder and manager of the GRC Makerspace. I can say that this is a unique space within the Commission and within the European Commission. And it's also a space where we are experimenting different formats of citizen engagement that are more focused on material deliberation and do-it-yourself approaches. So before I start introducing the panel members, my four speakers, I would like to thank them for accepting to be here today. I think they have very interesting stories to share with you, and I think they'll find them very inspiring. So without any delay, so I have with me Valeria Dammicco. Valeria is a researcher at the Institute for Manufacturing at the University of Cambridge in the UK. And so in these last months, she was mostly occupied, I would say, looking at the maker's response to COVID-19. She'll do a brief presentation where she will give us a worldwide view, but also then focusing on the UK ecosystem where she was mostly focused, let's say. Next, we have also Meta Stular. Meta is the manager of RogLab, Creative Hub, and this was the very first Fab Lab in Slovenia. She's also an expert in cultural development in the field of creative industries and cultural heritage. And she also worked as an external expert for the cultural program at the European Commission for various years. She's also the founder of the Culture Maker Institute, which is a Slovenian agency focusing on cultural development. Next, we have also Antonio Migneco. Antonio works at the Joint Research Center. We are colleagues, even though working in different areas, but he's not here today to really talk about his work at the GRC. So Antonio, during the COVID lockdown, the first COVID lockdown here in Italy, Antonio was very busy. He put his 3D printers to good work, and for a few months he was consecutively printing non-stop face shields, which were then donated to various institutes in Italy and also abroad. But then I'll let Antonio tell you the rest of the story. Also, Antonio usually collaborates with us at the GRC Makerspace and helped us in several activities. Last but not least, we have Cesar Garcia. Cesar is the co-founder of the Makerspace in Madrid and is also the host of the La Hora Maker. This is a podcast and a YouTube channel with more than 6,000 subscribers. He also organized the Madrid Mini Maker Fair and is affiliated with Cotec Foundation for Innovation. During the COVID, he was also highly involved in the Coronavirus Makers Initiative in Spain. And this, for me, it was very curious. This was started as a Telegram group, and in less than 48 hours, it got more than 1,000 members, and 2 weeks later, more than 16,000 members. So I'm curious to know more about this. So I think this session will be slightly different from what we are having so far in the symposium. I want this session to be more as a conversation where we can discuss the different aspects related to the stories that the four speakers will tell, but also how they were involved in different communities that were responding to the COVID-19 pandemics. To provide you some background information, the Maker movement became quite active when the COVID-19 pandemic crisis started, and that led to a high need of medical devices and protective equipment, both for the healthcare, but also to provide assistance to patients. So due to this, there were several individuals that, a few thousands of individuals that started to mobilize themselves, creating different initiatives, different communities, and they attempted to respond to this urgent need of medical equipment and protective, personal protective equipment. So we had the engineers, healthcare providers, but in reality, it was anyone that wanted to help and could help that was coming together and to address not only the challenge of designing, manufacturing this type of equipment, but also distributing this equipment to the persons in need. And so this was, it was, for me personally, it was amazing how this could be done often without a central institution or a government entity coordinating all these efforts. To start the discussion, I'll start with a very generic question to all the speakers, and it's simply if you could describe what was your particular situation, and also in your country, and how and why did you become involved in this movement, and also how the community did emerge. I'll start with Valeria, which I think can provide us and also can complement what I said by giving us a clear picture of the situation worldwide and then in particular in the UK. Valeria, please.
Thank you, Paulo. Let me share my screen. So me and some colleagues of mine at the Institute for Manufacturing at the University of Cambridge became quite interested in what was happening around us during lockdown. We witnessed this upsurge of open source projects and this incredible maker ecosystem that really helped healthcare practitioners and civil society to tackle the spread of COVID-19. And there was a large press coverage of these open source projects, as I think we heard greatly of the face shields, blueprints, and the ventilators that very early on during the crisis were put forward by makers and then spread rapidly worldwide. And we became interested in what was happening as researchers of innovation. We wanted to understand more of what the response was about. And so what we tried to do between March and June, where the pandemic was at its peak and most countries were in lockdown restrictions, we started to map this emergence and monitor the social media and news coverage of these open source projects, especially looking at Facebook groups and Twitter using relevant hashtags and other existing databases to kind of understand what was happening, who was doing what, and which sort of technologies and project and process. And I'm going to share with you some of the insights of this initial research that we are carrying and complement some of this very generic data on some more nuanced details about the UK case specifically, as me and other authors of this research had the opportunity to talk to some of the members of the makers community in the UK, very different people and projects, and we asked them about what worked and what didn't work, and how the process went on. And so I'm going to share with you some of these initial results. We documented 157 projects worldwide, and the more nuanced details about the UK case is also available as a seminar on YouTube if you are interested and would like to look at it. It's called Make Plan C, Make a Response to COVID-19 in the UK. Right, so first of all, what we witnessed was the incredible and amazing variety of project types that spurred out of the maker community. From very basic do-it-yourself techniques and projects, such as the face masks, for example, to more advanced and complicated projects like ventilators. And among these, face shields and face masks represent more than half of the sample of the projects that we identified, and while a third is represented by ventilators. And the other categories represent a minor range of novel maker responses, such as door openers or testing kit components and so on. And if you look at the distribution of the upsurge of these projects over time, it is possible to observe how obviously there was a very initial high spread in March of these projects, which reflects how the makers' response had to fill in a big institutional void in current supply chains worldwide, and had to operate under a done is better than perfect ethos, so had to operate quickly. And this resulted in a great number of projects that spread rapidly in March and then decreased later over time as governments and healthcare started to regulate and standardize these projects. Something also very interesting that appeared is that when we looked at who was behind this open source project that were reported and shared online, we realized that the majority of innovation actors behind these projects were unaffiliated hobbyists. So as we know, the maker community is quietly entangled with makerspaces and fab labs and hackerspaces and so on. But in this particular case, you can see that these the fabrication spaces, such as I said, makerspaces and fab labs, represent only a portion of the authors behind these open source projects, and a large part of these innovation actors were also peer-to-peer hobbyists working from home, or NGOs or other digital fab manufacturers or services, which highlights that this is a highly varied and informal maker ecosystem and network. And as a result of this first observation, we can also see that this is reflected in the type of manufacturing technology that was used, as most projects were using 3D printing and do-it-yourself techniques, which shows a preference of the maker movement towards easy-to-access and low-cost, small footprint technologies, while laser cutting and injection molding or other workshop technologies usually required affiliation with an institution or a workshop, as individuals alone cannot afford to buy this equipment usually. So that was also an interesting finding. And then we, as I said, we went to talk a bit more in details with some of these actors, and we also this panel, and we asked several questions about what went wrong and what didn't work, and some of the problems perceived by these actors emerged, and that can be summarized in four main problems. The first one that emerged from the UK specific case was a lack of a formalized network of makers, because unlike other countries like France and Germany, and I think Spain as well, there is no national network of makers in the UK. And for the most part, fabrication spaces and more broadly, the maker community operates as a locally driven and independent initiative, which highlights the importance of leveraging the personal network that each of the actors has. And this raises the question of what happens when these personal networks are not enough. And this crisis was driven by this incredible ability of people to connect with each other. But can we do more? Can we establish? How can we help makers connect to each other? Maybe, yeah, the creation of a national network of makers could be one of these ways, but I'm open to discussion on this point. And then there was also another point raised, which was the huge problem of a lack of communication on the demand side and a lack of understanding about the existing demand for critical items, and poor linkages between the healthcare practitioners and makers. And healthcare practitioners, on one hand, struggle to precisely define their own needs as the crisis situation was evolving, and on the other hand, makers were also struggling to kind of understand these needs. And there were some efforts to create some centralized database in the UK, but they fell short of creating a coordinating platform, and this was perceived as a huge problem. And so again, in the future, it is important. This highlighted importance to make the maker community more visible to civil society, and to really integrate it and consider the maker community as a part of a manufacturing network. And the lack of production standard would also perceived as a huge problem, as on one hand, there is this beauty of the maker culture that is inherently linked with the idea of tinkering and adapting things to their own local needs and local resources. But on the other hand, during the crisis, this opened up the new challenge of standardization, and which is fundamental especially in times of a healthcare crisis. And this again raises the question of can fabrication spaces, can the maker community be turned into a more into a manufacturing space, a proper manufacturing space, and what needs to be done in order to achieve this? Probably there's also a need to make a big shift in also cultural mindset of makers. And lastly, the problem with voluntarism and innovation, as many makers' activity, especially during the crisis, were driven and largely dependent on big donations of money from people and citizens, and crowdfunding and donation of time and resources. And the question that was asked was, is this possible? Can we rely on this in the future? Is this possible? Can we do this again in the future? And will there be the same level of enthusiasm if a second crisis were to arise? And how could this response be replicated? And yeah, I think that's all for now. I'll leave it to the others. I think I took more time than I should have. I'm sorry, but thank you for listening.
Thank you, Valeria. It's very interesting. Looking at the challenge and seeing also compared to some of the interviews that I did, and seeing that some things are really recurring, but at the same time, others that are not were not the challenge. I mean, for instance, a part of the network, like you said, there are some countries that have a national network, so in terms of coordination, it works a little bit different. But again, yeah, the question of the last point, for instance, of course, in case of volunteering, the crisis didn't pass yet, and so we are seeing in some countries already the same situation that we had in the beginning. And I won't ask you to answer to this question at the moment, but it might be a question that stays in the air. How will the maker movement now respond to this second wave, if we will continue the efforts or if we could fade out? So I'm going to give now the stage to Meta.
So in fact, I will start with this concrete situation in Slovenia during the COVID. And we had some kind of centralized initiative that was started by Technological Park in Ljubljana. And they have made a network of makerspaces, but also individuals that have the makers technologies at their home. So first they made this network, and then all those people were producing more or less 3D printing face shields, masks, and stuff like that. So and then collecting them at the Technological Park, which was then distributing them to different, with the help of civil protection organization, to different medical organizations. I think that this situation was quite similar to everywhere in Europe or in the world, but I would like to talk more about what we have discovered during this process. And at the beginning, I would refer to what you were saying, Valeria, that you have discovered that there was a lack of standards. There was lack of quality control and so on. And this is somehow quite characteristic for maker society, you know, because more or less people are trying to do stuff, you know, but in this eagerness to do stuff, maybe sometimes they forget about is it really, you know, completely useful or not. But I think that this part could be solved by one thing, and this is by connecting the maker communities more to the expert communities. Not to make the makers community an expert community who would then test and proof test everything, you know, because this is somehow not the thing in these communities, but to connect them better with universities, with faculties of health science, stuff like that. Also, I have seen that for the days where, for the time that we live in this complex society that is really changing fast, we still have, for example, civil protection organizations who is more or less just made of, I don't know, fire brigades and people like that. But maybe these civil protection organizations could also have some members from creative parts, you know, from maker society and so on. So there would be many more expertise from different fields to solve such complex situations as pandemic, for example. Because pandemic, it was not just about face masks, it was also about lack of food, it was about loneliness, it was about many stuff that you cannot just solve with 3D printer, for example. What we have also discovered that you know, there's a enormous lack of basic technological skills in society, that less people don't know anymore how the most simple appliances in their kitchen work. They don't know how to repair them, you know. So in situation like that, you know, this you know, idiocy of our hands really becomes very visible. And I think this is also a chance for makers community to show this and to somehow to build from this, that in fact, you know, we as society became completely technologically and technically incapable somehow, that we are really, as individuals and societies, depending on big corporations for our things that we use, for our food that we eat, etc. And when the pandemic hits or another crisis, then we see how vulnerable we are, because we lost this common knowledge, and because we lost these basic skills somehow. So I think that in the future, I would say that we should work on this and we should think about it. Otherwise, in RogLab, we have quite a lot of experience with for example, with our open calls to tackle, you know, quite not so funny things like how humanity is getting older and older globally, and we don't have enough products for them. How 10% of population globally is handicapped, and we also don't develop products for them. And now with this COVID situation, you know, from all these experiences, we have realized that there is a strong community of makers out there, and we think that they have really strong values. They want to contribute to the society, you know, and that in one hand we have this this big community of individuals and of makerspaces who are really value driven, who are innovative, who want to give their private time and space to communities and so on. But somehow we do not tap a society into this pool of creativity. Somehow it's not somehow it's not used enough. It's not connected to other parts of society, for example. And I think that this is also something that we should work on and we should continue, because in general, you know, there are lots of people who want to connect, who want to share their knowledge and so on, but somehow they are not connected systemically to other spheres of our societies. Before, we also talked about how makers movement could become more centralized or more dependable in this kind of times of crisis. But I think that we should not make them somehow makerspaces. We should not change them into this kind of stiff institutions where everybody knows what he or she should do, because this is not the makerspace or the makers somehow nature. We should see what the maker's nature and makerspace's quality really is, and this is adaptability. This is this is creativity. This is flexibility and stuff like that. All those all those characteristics, in fact, that are needed for the time that we live in, that is changing really fast, that we in which we also have very strange surprises such as COVID and so on, and we need this kind of flexibility in the society. And instead of making maker spaces or making movements into some kind of centralized organization, I think that we should open a debate between our institutions, our national and international institutions that are in many cases already behind the development, and between the maker spaces that are really eager to respond to all kinds of crises and so on, but are maybe not structured enough. So we could make this kind of dialogue between those two structures, between those different communities, and see how we can go further. Of course, respecting the nature and the values of each of those communities. So this is from my side.
Thank you, Meda. I mean, there are 2 points that I think are very relevant. The first one, of course, is having the different types of expertise in the communities to address these issues. And the other one is, as you mentioned, the question of the losing of skills, of this type of skills, that it's become, with the crisis, it was shown that it's important to retain these skills, and Makerspace can help in this situation. Thank you. I'll give now the voice to Antonio, which I hope will continue the story that I started when I presented. Antonio, go ahead.
Yes, thank you, Paulo. Can you hear me?
Yes, perfectly.
I totally agree with the Meta about we are in a lack of losing handmade activities at home. So Makerspace and Makers activities is a really good thing that really involve us in many of these things that can be very useful. So I am one of the makers that during the COVID was trying to do something to help the others in some way staying at home. So I already own one 3D printer, and it's okay, let's see if I can do something 3D printing by face shield, because I found on internet that there was another country already makers was printing. So okay, let's try. So I print few of them, and when I went to call a friend that was working in hospital and asking to him if they were interested to have a few of this 3D printed advisor, he said yes, for sure, because we don't have it. We're missing a lot of this protection devices. So, okay, so I start to print it. And really, in a very, very short time, I got so many requests from the hospital in the area. Also because there was some newspaper writing about this activity, and also the notice was spread on internet by some friend. So in a few days, I got many requests. So with my friends, we start, okay, let's organize it in a between the friends. So there was me printing, some other one there was cutting, preparing the PVC screen, and some other were delivering in the hospital in the area. But in really few days, it's become more large the situation, and I got like 1,000 requests. So we start trying to find money to buy the materials that we need, and I made a very small web page with the activity I was doing, and asking for donation of money or donation of material, and also asking if someone need my face shield, just writing me an email. And by the website, and I got money enough to buy more 3D printers, and so in the end, I was with 6 3D printers, and I printed more than 3,000 pieces. That was delivered all over the Italy, starting from Lombardia. That was the main region, with the problem of COVID. And from there, all over Italy and abroad, I got registered for France, Germany, Belgium. So, also with the help of some friend working for a company, I delivered in one day in the hospital MISC 1,000 pieces. So it was very strong activity for us, but in the same time we was facing with the problems, because it was not just problem of money or problem of finding materials, but with the bureaucracy. Because the hospital was asking us, okay, do you have certification? Do you have any technical specification about the material you use? So in some way, it was not easy to deal with these things. But there was some smart doctor that was like helping us. Don't worry, I will take the responsibility to use these devices. Don't because the hospital can't accept your donation, but I can take the device and use it. So this situation happened with many hospitals. And plus, then I got many requests from old age home and from medical clinics and so over. So I get involved to the civil protection. So I was giving the face shield to civil protection to distribute to the clinics and to the other hospital all over the Italy. So it was very nice activity, but also giving a lot of responsibilities and to deal with many aspects. So I don't know. I was very fast. Give me questions and try to answer because.
No, thank you, Tony. I think you touched it also for me. It's an interesting point, which was the way you reached the medical staff. So in the end, it was a friend. I had similar stories about it. That I mean, in the end, it was friends of friends that were getting the equipment, and of course, also the way to bypass the bureaucracy that was being implemented on the hospitals and the certification issues. At one point, it was. The equipment was not being delivered to the hospital itself; it was being delivered to the nurses, to the medical staff, and it were them that were picking them up and using them.
Exactly. Then also my job doing this was design a new layout of the face shield with the collaboration of some doctors, because they was very interested to this activity and they want to use the face shield during the surgery. So they asked me some specification to modify the design. So I spent my nights to the 3D designing the new shape. It was a nice activity. And also create a few hashtags to try to involve people, like help to us to help, that in Italian sounds aiutaci ad aiutare. So this was very useful also because it was spread out over the internet. And something also that I see people like it a lot was that we use PLA for material, not ABS. I don't. In this moment, maybe that doesn't really matter. But if you was saying that to the people, you was using material that was bioplastic and not just plastic, so something that helped with the people to help.
Thank you.
And then in the end of this activity, I'm donating the 3D printer to the schools in the area. So in a few weeks, the two schools in Varese and Milano area will receive 3D printers that I was doing. So I hope in this way the students will try to understand what was the help of these 3D printers and with the makers in this COVID, and I hope that they will follow this example for the future in case we need it. So
thank you very much. So I'll pass the ball, let's say, to our last speaker, Cesar. So the floor is yours. Thank you.
So thank you, Paulo, thank you everyone for attending the conference. I heard so many interesting things. I would love to get into some of this, so I will do a brief presentation and just also try to tackle some of the things that have been discussed in the previous panels. So in Spain, we got the message in the press that there was going to be a lack of respirators or ventilators. In the press, it was like the most urgent thing. So in a way, there was this call from Ireland that some people were trying to create a Facebook group to organize around making ventilators. So we said we don't usually in Spain, is not really the platform of choice of makers. So let's say someone decided to open a Telegram group, kind of like WhatsApp, with this idea: is it possible to create an open source ventilator that can be mass produced in distributed way using 3D printers? And this is a question that if we take each part apart, yeah, mass produced, distributed, there are some really hard questions there. So the thing is that, as Paulo said, there was this group called Coronavirus Makers. There were 16,000 volunteers. And indeed, the first week they were growing like 1,000 new people a day. And there was this question of how do you organize 16,000 people? Let's say you are trying to produce things. It was all around Spain. So one of the things, like Paulo said, I was involved in the group, but I'm also do some research. So I tried to figure out how is this thing organized. So from the information, let's say there are 100 groups, and indeed there is some kind of general conversation group going on. How are we going to deal with the crisis? What are the things that could work or not? But eventually they emerged some kind of R&D groups, people that were to produce respirators or some particular models of face shield, face masks. What can we do? But one really important part is that people organize themselves in regional groups to produce, like in Madrid, Barcelona, or Galicia. There were groups that say, okay, we are going to organize people that have 3D printers. So when the model is ready from the R&D groups, we are going to produce them. So there was kind of this distribution of work that emerged. Of course, there were people that were in both groups, so it wasn't like producers and designers. But it was strange that this emerged from the community. One of the biggest challenges is that when we think about ventilators, there were some previous design, but once you start looking for the certification, the trial scene, there were none. So we were like, okay, for the first month, we thought that there were some things we could use, but they were not like ready for use. So one of the things that we discovered also is that doctors are not really friends of Telegram, or they are not used to use Telegram. So we decided to create a forum where we could kind of collect all this information. And for example, Pancho Cañizo, that is one doctor from Gregorio Marañón, said, okay, I'm going to talk to everyone I know about ventilators, and we're going to create some initial specs, because it's not like makers know anything at all about ventilators before pandemic. So one of the first one that was quite active was Resistencia team. They started in the north of Spain, created this using laser cutter, 3D printing. Yeah, in the end, a lot of people launched with prototypes, and it was quite crazy. And people were like, why are there so many people building ventilators? We are not going to need so many models or so many things. And now it's time we discuss this idea about plan A, B, C, because I know this has been quite popular from Make Magazine, but the original conversation comes from Cotec Foundation here in Spain, that they say, okay, plan A is we have money, we have manufacturers, we can buy everything, we have stock, unlimited stock. Yeah, no problem. It wasn't the case because, of course, manufacturers were absolutely over demand. Plan B is we can change some manufacturing companies, and eventually they could like transform their manufacturing capabilities to tackle this problem. But this is slow, requires certification, liability, etc. Plan C is DIY is the only way to go. So we go ahead with this plan C and see what happens. As a side effect, I was really interested into Valeria graph, and in the first month there were a lot of ventilator projects. Eventually the number went down, and Facial took the lead as the leading part. And one of the reasons is like there were like 10,000 people, at least in Spain, that were looking to help and print things to fight pandemic, but the ventilator model was not ready. So eventually what happened with the distribution of the manufacturing network there, in Spain, they were producing about 40,000 shields per day, and the accumulate was like 1.1 million face shields donated in total. That is kind of an insane number. And most of the work was done by individuals at home doing this as non-for-profit, like just volunteering and working together. Another part that is really interesting is that there were more than 37 ventilator projects in Spain. I mean, I have a database around 60 ventilator projects. It's insane, things that happen really fast. And from our side, one of the highlights or the most interesting parts is that through Cotec Foundation, we were able to organize a meeting with the national agency that certifies the ventilators. So we had an open call with people designing ventilators that were 125 people in the call, asking questions directly to the ministry. What are the tests you are going to ask for? What are the steps we need to certify the ventilator? What are you asking for makers? And I think this was kind of like an open window for all the people just to sit down together and contribute. And the best thing is that after the whole pandemic, there were 7 to 8 models approved for clinical tests. That I think is insane given the timeline constraints. Yeah, there are still some open questions. I absolutely agree with most of the things that Valeria and Antonio and Meta said before. But if we focus on ventilators, we need to keep track of what's going on. How do we keep track of, out of these 8 models, which work? But the second thing is, how do we prevent starting from scratch again? Because there are lot of models, most of them have been abandoned. There has been a lot of knowledge and a lot of collaboration. How do we keep on working together and prevent like going from zero? Again, I think this is kind of key. And also, just to finish up, the last thing we are working on right now is there is an emergency ICU mask that could be used by doctors in hospitals. It's kind of silicone grade, everything medical. But I'd say that this kind of open window right now is kind of closing or closed. So it's not easy anymore for makers to take their designs and take them to the field, to take them to the actual problem. There have been some advances, and to get this from Meta, for example, in Canary Island, there has been an invitation for maker communities to get into a registry of civil protection groups, so they can engage into this kind of examples. And I think it's quite powerful. But again, the most challenging thing in Spain, we have 17 regions, each of them with different laws, each of them with different requirements. So we can take one face shield from Madrid, it could work in Madrid. We take it to Barcelona, it will not work there. I assume humans and virus is kind of the same, but bureaucracy is not the same anywhere. So yeah, a lot of people contributing from our side, and I think it was quite inspiring. And this is kind of collaboration of Fab Labs and civil protection and people working together to bring this. So yeah, that's it. Let me just answer so Paulo can come back.
I'm back. Thanks. Well, Cesar, this is amazing. I mean, honestly, I remember talking with you in the beginning, and you're saying, and you write me saying that you had like you're preparing a report where you were analyzing around 60 ventilators, and this is really crazy. I mean, even you arriving to 7-8 models, even though it's still a high number, but it's I think it's amazing to make sense of all of this data and of all of this knowledge, and also, of course, I mean, in this case, also it's important. It's vital to have the medical community behind, and I think you did that very well. That you were able to reach, and they were willing to help, and also you were able to adapt the communication channels to their needs. I saw that there were some questions that were being put on the chat, but in the meantime, you also started answering them in the chat. So thank you for that. maybe I'll do some follow-up questions on your presentation. So, Valeria, you were giving us an overview of your work, and specifically also on the UK community. Were you also looking at the motivations of the makers, why they were being involved in these communities, why they were doing this type of work? What were their main reasons? If you have any insights on this.
From the data we've collected, the main reason for doing this was a sort of call to action that makers perceived as something that they had to do because they had the skills to do it, right? Because they knew how to help, and what they told us was we need to try. And at first, like there wasn't this this big project of doing something that would have turned into a global scale up project, but it was more to answer a need for their local hospital or their local healthcare center, who contacted them and said, can you help us? And so, I like the motivations was mainly, we've got the skills, we can use it for good. And also, I think one big motivation seemed to be that the media started to cover this work that makers have done, which so far has remained quite invisible for a long time, right? Like makers have always operated and have always achieved great things, but for the first time, this was it was like suddenly the curtains opened up, and everyone suddenly became aware of this part of society which has huge potential for solving problems, and so I think that was a motivation as well that played a role.
Antonio, do you reflect yourself on this type of motivations? Also, what was for you the key reward from this type of experience? I mean, when after delivering all these face shields, helping the institution, what did you felt?
Well, in the end, what I was thinking really was that usually we think about social media, Facebook, or wherever, internet, something that divide us, not really social. But in this case, it was something that was connecting us all together while we were at home. So it was thanks to the technology, to Facebook, to all the social media, that it was able to help the others, from my case, to print the face shielding. Otherwise, without that, it would be not the same. So in this case, the internet was putting all us together.
So I have a question here from. This is from the stage chat. But basically, it's asking. So the ethos of some makers is to reinvent wheels and start with their own thing. So how can that be integrated into societal effort? So anyone can give it a try. Any ideas?
Yeah, I think I was during summer, during the Fab Lab meeting, we have a panel on open know-how. That is a new standard that is being developed, and indeed it has in some way passed. Well, there are like two standards for open hardware right now. One of them has been approved in July in Germany, so it's already a standard designed for the standards body in Germany, and indeed is registered as the first open standard of the whole catalog in Germany. So one of the things we were figuring out is, should we devote October, that is the open hardware month, to document properly things that have been done. So I think it's a bit. I agree with the chat that makers would love to start from scratch all the time. I mean, I would love, but there were some challenges also, because, for example, with the mask, there were people working with face masks, and they were like, now that we are a big group, we are getting the attention from groups that have patents on face masks. So if we don't start from scratch, if we start like from somewhere else, we could get in trouble. So we need to prove we are starting from scratch. And I think that's one of the one of the other problems. But I think most of the one of the things that I've seen at the beginning was quite close collaboration from doctors and makers hand to hand. And not all doctors have the same mindset. For example, this doctor Pancho that we talked before, he was kind of the dean of the experimental surgery department. So he was quite experimental his whole life. You talk about Arduino, Raspberry Pi, electronics, and he knows about all these things. So it's like, oh, I already used this to do liver machines 10 years ago. And you're like, what? But another thing that is quite a challenge, at least was quite a challenge during the time, and I think that made a lot of sense, is that one of the absolutely unexpected problems we were facing is the lack of supply. So at the beginning, Valeria was talking with the lack of demand, and I agree that maybe it wasn't clear what was the right number of ventilators. But one of the things we discovered is that the more models we had of ventilators, the less chance we had to find critical supplies of things. For example, one of the models was using a sensor. And if you try to get that sensor, it wasn't available anywhere. So if you could produce a ventilator that eventually worked, but didn't use that piece that was not available, this could be manufactured. And the biggest challenge, and I think that was this is the most unexpected thing. SEAT, that is building cars in Barcelona, retooled one of his lines to produce ventilators. And one of the problems is like, okay, if SEAT asks for a motor, for a piece, of course, all the providers are going to sell the piece to SEAT and not to the makers, because SEAT is where the money is in the long term. So I think having different models and different alternatives in this case, where we were in such uncertain times, was quite a positive. To see different ways to solve the same thing, but without using the very same pieces all the time.
I think it's also, I mean, a situation that I also saw in relation to the SEAT example was that in my country, in Portugal, that for instance the price of the PET to produce the face shield at one point it increased drastically in the commercial surfaces because the demand was simply too high, and so they started taking advantage of this situation. So you end up spending 50 euros for something that before would cost you 2 euros, which is simply crazy. Yeah. So I have another question from the chat, which is also interesting. So your stories and experiences are of people working for the common good. I suppose there are makers of different kinds and with different values and goals. Can you say something about that?
Yeah, I can, for example.
Go ahead.
I see that, we have many users in the RogLab, and some of them they have this kind of open knowledge sharing values, and the other ones they're just hiding their stuff because they think that they're the only ones in the world that they have discovered something like that. But I think this is a choice of every individual. But I see there the question of Silvio, because he's implying that there are probably also dark makers, since there are dark hackers. And I don't think that there are some people who want to make physical appliances that would harm you, for example. And it's a little bit different because in makers' world, we have to do with physical stuff, while in hackers' world, we have to do more or less with digital stuff and with money. And hackers, they do stuff because they want to draw money more or less from somewhere, or they're challenged by different situations. But I don't think that makers want to make I don't know, a doorknob that would hit you or something like that. It somehow doesn't make sense for me.
For me, looking at this question, the example that comes to my mind was of some of makers taking advantage of the situation and, for instance, selling the face shields. But then the curious thing is that I came across these examples because there were other makers saying, look at this, what these guys are doing. So they were, this is, I mean, we can get these things, you can get this equipment for free. We'll gladly give it to you. Don't buy this equipment for them. So
I think
it's also happened, it's also happened with us that someone was asking our face shield, and then I discovered it was because they want to sell it.
Yeah, see, this is even worse.
So
yeah.
Yes, there are also this kind of people.
I think that we would need to define dark in this context, but I would say that one of the most breaking points about the whole conversation is, how do we sustain this? How do we sustain? Some people say like, oh, this is just volunteering. There is no need to sustain this. Everything is going to be sorted out, no problem. Other people were like, okay, maybe we don't need to charge this for this, of course, but we need to get some money for the materials. And so people were like, no. The only way people can participate is they buy the materials with their own money. And they were like, okay, but what about people that are willing to print but they don't have money? Or maybe, and there were all these question of class that is invisible in a way. But again, there were people that were working at home for a multinational company and they could put the printer, and there were other people that were unemployed and they were 3D printing. And they are all makers. But in a way, it was the conversation of, why are you asking for money? And it's like, oh, you are like being paid 5,000 a month to stay at home. So it's no wonder that you don't have this conversation or this problem. But for us, it's kind of the same. Also, Dorothy's talking about the social norm. I think one of the things is kind of the problem of free riding. People saying, oh, this is my design. I did this. Because, of course, there is not only the money, but also who is the designer. Also, the problem with, there was a huge conversation on licensing. Oh, for example, there was a group of people working in the ventilator that said, we want this to be open source, we want this to be free, but non-commercial. And we're like, how do you bridge this thing? Because if people are free to do whatever they want, they could have this commercial, they could produce it commercially. No, I want this commercial, free, but non-commercial. So there is this conversation, and I think that that's quite challenging, because most of the people just wanted some kind of freedom that only seeks in fantasy books. It's like, I want the freedom that people uses this just in the free way that I would like to. And so I think that's a challenge. So there was a lot of conversation on what is the right license for this product to exist. How do we make sure that this, and also the big question for the makers is, how do we make sure that the things we are produced are open from anyone to use? How do we make sure that no other people are limiting the freedom of other third-party people by applying restriction to open models? So there were like all these kind of derivative questions around licensing, the design, the ownership. How do you keep something that is distributed open? I think that's a very, very interesting point.
And also,
Go ahead, Valeria.
Yeah, I just wanted to say also, who is liable for maintaining and repairing this equipment, right? Because at the point where like a ventilator that has been developed open source breaks down, are you going to train people to, like in healthcare centers, to take care of that? Or are you going to stay liable, like as a maker community, for this problem as well? That was, right? Like how do you solve that issue?
I think the time of the session is finishing. Unfortunately, I think this is we could continue discussing a lot more about this issue. My suggestion is, if you still have a few more minutes, is that we all move to the sessions area, to the coffee corner. So there is this special place where you can talk with the audience in a more informal way, and where you can see all the participants of the session, so more in the video setting. So if we could continue there the discussion. To finish, I just want to make it a very short question that I highlighted in the beginning. So as the number of COVID is increasing, so do you think that there is still space for the maker movement to continue the work that it's been doing, or do you think that this will stop now? So Valeria, let's follow the initial order. Very shortly, one sentence, Valeria, please.
I have high hopes that this work will continue, and I'm confident that there will be ways in which the maker community will keep helping. I'm not sure whether in the same way that has been done before, but I'm sure they will.
Thank you. Meta?
But I think that not in the same extent, because the first shock went away anymore. A little bit more political, because I think that makers movement with its values is tackling all that is wrong with consumption society and empowering people into knowing how to make things and not just buying them can give a big power to society. In fact, you can choose then, you can say that you will not buy something, but you will not need something from one company because you know how to make it yourself, for example. And I think there is a momentum for maker society to ask a little bit itself, where do we want to go from here, How do we somehow mainstream our practices, our values, etc.
Thank you. Antonio?
This is it.
Sorry, I hear you guys very bad, I don't know why. But I agree with Meta. So this situation give more power to the people, and this can be tricky. And also this kind of movements like makers, wherever, maybe need some be regulated in some way, or have some regulation, or the way integrated with the national government. So
thank you, Antonio. Cesar?
Yeah, I think as Meta said, some of the makers of this original group have launched kind of a non-profit initiative just to think kind of long-term, more to stabilize and to give a proper structure to work towards these kind of political goals. At the same time, some of the people that are making non-stop from the beginning are already working in new projects. We are in the post-face shield moment, where these people are like, oh, we don't need to keep 3D printing things. We need other things. So there is one group that is trying to replicate an open source robot for labs to help speed up the testing of COVID in the hospital. And there is another one led by one school director that is using Arduino to measure the CO2 in the room so they can help the teachers to get reminders to open and ventilate and get some kind of he's in Salamanca, so it's like -2 degrees during winter. So they any kind of help in this term of how long should I open could be helpful. So these are more like experimental things, but I agree that we as maker community, I think there are a lot of challenges ahead, and I think that flexibility and adaptability is kind of the key here.
Thank you. Well, our time is over. Thank you very much for participating. It was a pleasure. I hope you also enjoyed it. Okay. Thank you. Bye.
Thank you.